This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2024. Total ankle replacement, or TAR, is a surgical procedure used to replace a damaged ankle joint using an implant. However, the procedure is associated with high risks of early mechanical failure and revision, and the risk factors for early mechanical failure in TAR are not well understood. To address this, a group of orthopedic surgeons conducted a retrospective study from a single institution registry. The study examined 731 patients who underwent a primary TAR, initial surgical procedure, with any implant. They grouped the implants depending on the type of fixation and employed a statistical regression model to determine the effect of weight, age, implant type, and hindfoot arthrodesis on failure. Among the participants, 10% had hindfoot arthrodesis and 4.5% experienced mechanical failures within a mean of 1.7 years postoperatively. The analysis revealed that hindfoot arthrodesis was strongly associated with 2.7 times greater odds of failure, whereas every 10 kilogram increase in weight raised the odds of tibial-sided failure by 1.29 times. Notably, implants with extensive tibial fixation lowered the odds of failure by 95%. This study highlights that hindfoot arthrodesis and factors such as weight contribute to early TAR failure, but implants with robust tibial fixation may help to mitigate these risks. In conclusion, the study underscores the importance of understanding risk factors and employing appropriate implant choices to enhance the outcomes of TARs.